Sex is one of the most talked about topics, or rather seemingly taboo topics in the world, yet also one of the most misunderstood. A core component of overall well-being, yet it remains surrounded by widespread myths and misinformation. Noticing our society today, from pleasure to protection, many of what we know about sex are shaped by myths, silence, and misinformation. Today, we're separating fact from fiction as we examine the truths behind sexual pleasure, sexual health, and sexual responsibility that comes from informed choices. Welcome to Health Matters, your number one guide to health and wellness. I am Amanda Amos-Igbuwe. According to study report, it shows that while most adolescents have heard or read about sex education, only about 4.6% indicated that they had good understanding of its definition and implications. Another study in Enugu campus area revealed that only 38% of students have good knowledge despite having a good attitude towards the subject. Now, one review noted unintended pregnancies in unmarried and adolescents between 23.4% and 92.7%. Another, a 53.8% high rate of unsafe abortions. And then we see students' population where STI prevalence has been reported to be around 22% with poor knowledge about prevention. Joining us to unpack this is Elizabeth Adewale. She's a certified holistic sex educator. Thank you for joining us, Elizabeth.
Thank you for having me. I'm so happy to be here today.
All right, I'm excited as you are. So let's delve into this. But before we go deeper, in your opinion as a certified sex educator, at what age do you think children and teenagers should be exposed to, sex education, sex health, and anatomy?
Okay, so I think as early as age 2, age 3, age 4, yes, because sex education is age appropriate, and from a very young age, you should be teaching your kids how to name their body parts correctly. You should be teaching them about their body anatomy. You should be teaching them about how to recognize safe versus unsafe touch, how to have boundaries, how to communicate their boundaries. So as early as age 2, as long as your child can walk and can, say some words, you should start teaching them about their bodies, and it should be age appropriate as well. So as early as age 2, age 3, age 4, they should be exposed to age appropriate sex education.
Okay, that is such a brilliant take from you. A lot of the things, we know about sex are from hearsay due to the fact that sex, if you agree with me, has become a taboo topic. You can't randomly talk about it in most African households. You can't talk about it in the society because you're going to be perceived in a certain way. So what are the most common myths that people believe about sex, and how do these myths affect their health?
Okay, so I think a very common myth about sex that most of us can relate to, or most of us are familiar with, is that sex is dirty, it is shameful, it is harmful, it is dangerous, or it is immoral. Now, this myth creates a culture of silence and shame around sex. So people are afraid to ask questions because they don't want to be judged, or they don't want to be seen as immoral. People are afraid to seek health care even when they have serious concerns. People make wrong decisions because they don't have access to the right information. Some other very common myths that I hear so often is that the pull-out method can prevent pregnancy or STIs, or that using condom makes sex less enjoyable, or that you can tell somebody has an STI just by looking at them. So when somebody looks clean and fine, they don't have an infection, or they don't have an STI. I hear some other ones like having sex while standing up can prevent pregnancy because the sperm will not be able to swim upwards. All of these myths and so many more, they lead to wrong decision making because people don't know the right information, so they make the wrong decisions, and the consequence is evidence. Like you said, we have increased rate of STIs, unplanned pregnancies, unsafe abortions, and people that are generally shameful about their bodies and desires. Yeah.
Because it's such a passionate topic. When I thought about this, I saw how the society seemed and how it's a taboo topic. And as people interested in health, we shouldn't be ashamed to talk about some certain things. So why there's a myth, that sexual health, we're just talking about disease, we're talking about pregnancy prevention. So first of all, that is that myth, and we want you to debunk it. And then secondly, how does pleasure fit into medical definitions of health?
Okay, so thank you for that question. So according to WHO, sexual health is a state of physical, mental, emotional, and social well-being with regards to your sexuality and not merely the absence of disease. So pleasure is an integral and a fundamental part of sexual health. In fact, pleasure is the key motivation for sexual activity because let's be honest, most people are not engaging in sexual activity because they want to have babies. Most of them are doing it for pleasure, for intimacy and bonding. But then when we remove pleasure from sexual health conversations, we reduce sex to just risk, danger, prevention, STI, contraception. And while all of those things are important, they just further contribute to the culture of shame and stigma and fear around sex. So yes, pleasure is integral. And I think the reason why pleasure is often excluded is because, in our, due to cultural and moral and religious reasons, people assume that pleasure means, pleasure is immoral, or it is sinful, or it is, you get what I'm trying to say? Like there's so much taboo about pleasure as a topic under sexual health, but pleasure, according to WHO, is an integral part of sexual health. You cannot have sexual health without talking about pleasure.
In clinical terms, now, you are certified, you have an MSc in Public Health. So in clinical terms, how is sexual pleasure connected to your overall physical, psychological, and relational well-being?
Okay, so there's enough research to show that people that engage or people that enjoy sexual pleasure or people that have healthy sex lives, they have a better quality of life. And I'll tell you why. According to research, sexual pleasure can, boost your mood through the release of dopamine, oxytocin. It can also lower your blood pressure, and it can lower your blood pressure and reduce your risk of heart attack because, sexual pleasure kind of increases blood flow throughout the body, and this can contribute to your heart health or cardiovascular function. Sexual pleasure as well can boost your confidence. It can boost your self-esteem. It can, increase your relationship quality. It can also increase your productivity at work. There's enough research to back that people that engage in sexual pleasure, they are more likely to be creative and productive and happy at work. And also, sexual pleasure can boost your immune system through the release of antibodies like immunoglobulin. So basically, sexual pleasure, it cuts across the physical benefits, there's psychological benefits, there's relational benefits. It is all encompassing. So yes, people that have healthy sex life, people that engage in sexual pleasure, they have better quality of life generally. They even tend to live longer than most. So that's what research shows. Yes.
Okay, so from a health perspective, what role we've heard about self-pleasure, and we're trying to separate it from the religious perspective. So, do I say religion aside? We're solely looking at a health perspective. So, what role does self-pleasure play in your health, body awareness, and sexual development?
Yes, I like that we're having this conversation. So sexual pleasure is a normal, it's a healthy, and it's an important part of sexual development, whether we like it or not. And I encourage self-pleasure a lot because it can help you understand your body. It can help you understand how your body functions. It can help you, know what turns you on, what works for you. It can even relieve stress, relieve tension, and it is a very safe form of sex because when you engage in self-pleasure, you don't have to worry about STIs or pregnancy prevention or whatnot. So self-pleasure is healthy, is good, as long as it is done with the right intention and in moderation. Yes.
In the key word is right intention and moderation. Yeah, so is there clinical evidence that understanding one's own sexual responses through self-exploration supports healthier partnered sexual experiences?
Yes. So according to research, people that engage in self-pleasure or solo play, they communicate better during sex. They have a higher level of sexual confidence because they are very familiar with their bodies, and they are more likely to experience orgasms and pleasure compared to those that don't engage in self-pleasure. So it's just like solo play and partnered play. Solo play is the one you do with yourself. Partner play is the one you do with somebody, right? So if you are good at solo play, if you engage in solo play, you're more likely to have a better partnered experience. So yes, there's evidence to show that people that engage in self-pleasure or solo play, they have better experiences with their partners.
Okay. So it's commonly said that sex is solely for procreation. What does science and medicine say about that? And how often, this is very key, how often is one advised to have sex?
Okay, so yes, most people believe that sex is just for procreation and for making babies, and it is due to cultural and religious reasons. But biologically, humans, we are one of the very few species that are wired to have sex for pleasure, for intimacy and bonding. And all of this is reinforced through the release of hormones like dopamine, oxytocin, serotonin, endorphins. These hormones are bonding hormones, and I believe that they are there for a reason other than procreation or for making babies. And for the second question, frequency of sexual activity, there's no fixed rule that, oh, you should have sex this amount of time. Although research says that 2 to 3 times a week is ideal for most people, is ideal for most couples. Although some people can do more than that, some people can do less than that. The most important thing is that you are having sex that fits your lifestyle, that fits your desire, and you understand mutual consent as well. So there's no fixed principle or fixed number of times you should be having sex. Just make sure that you're making that decision, a decision that fits your lifestyle, that fits your health, that satisfies your desires. So that's just the most important thing.
Of sexual health, and we're also talking about the responsibility, pleasure, health, responsibility. So from a health perspective now, what does responsible sexual behavior really mean?
Okay, so responsible sexual behavior means, number one, you understand consent, right? You understand that no is no, and you're able to communicate your boundaries as well as respect other people's boundaries. That is the basis and the foundation of a responsible sexual behavior. The second thing is that you are using protection, right? You're practicing safe sex, you are getting tested, you're not engaging in risky sexual behaviors, you are not engaging in sex under the influence of substance like drugs or alcohol. And also, it also means that you respect, like I said, you respect other people's boundaries, and also you are making decisions, sexual decisions that aligns with your well-being and your values, whatever those, whether they're personal values, religious values, cultural values. You are making a decision, you are engaging in sexual behaviors that align with those values. And also, you don't police other people's sexuality. It's also part of being responsible sexually. And also, you are making decisions free of shame, fear, or stigma. So that is what it means to, to be a responsible, to engage in responsible sexual behaviors, or to, make that's what it means to have to be responsible sexually. Yes.
As a society, what misinformation have we adopted that has distracted us from the fact that facts about sexually transmitted infections?
Okay, good. So there's a common misinformation I hear so often is that about STIs or sexually transmitted infection is that only promiscuous people or people that sleep around get or contract STIs. So this there's the idea that if only people that sleep around get STIs, it's just me and my partner, I don't have to worry about that. But the truth is STIs can be transmitted from one sexual encounter, from just even one person. From your first sexual encounter, you can contract an STI, and then this stigma makes it difficult for people to even get tested because they are scared that people are going to judge me that I'm sleeping around. It makes it difficult for people to get tested. It makes it difficult for people to seek early treatment. So when they even start having symptoms, they don't want to go to the hospital because they are scared that they'll be judged. People are going to assume that they must have slept with the whole world, and that's why they have these symptoms, or they're experiencing these symptoms. And another thing but the sad part is that this misinformation keeps STIs and infections, the rate is still increasing because people, because of that stigma that it's only promiscuous people that contract STIs. And unfortunately, most STIs don't have symptoms. And even when they don't have symptoms, you can still transmit it to other people. And STIs that go untreated for so long can cause infertility and major long-term complications. So yeah, that is a very common misinformation I hear so much, that, if only people that sleep around get STIs, only people that are promiscuous get STIs. And it is very, very far from the truth.
Something about some STIs causing infertility, and my mind really can't pinpoint some of them at the moment. So can you help me out with some of these STIs that cause infertility?
Okay, so gonorrhea, chlamydia, syphilis, those are the gonorrhea and chlamydia. They're the major STIs that can cause infertility because they can, cause pelvic inflammatory diseases, and that can, lead to fertility complications. So those are the two major STIs that contribute to long-term to infertility. And yes, infertility, chlamydia, gonorrhea, those are the major STIs that contribute to that.
That knowledge. For a society that sees this sex education, sex as a taboo topic, how do you think it has affected individuals' mental health and decision making? And what should be done moving on? What better things should be done moving forward?
Okay, so yes, like you rightfully said, sex is seen as a taboo, especially in this part of the world. And you know, there's this culture of silence, stigma, and shame when it comes to sex. People don't want to talk about it, or when they talk about it, they're hush about it. And this kind of forces people, because people are going to learn about sex one way or the other. So this silence and shame around sex forces people to learn about sex from social media, from peers, from even porn. And these sources are not always accurate. So when people get their sex education from these sources, they tend to make wrong decisions that can have consequences on their lives and futures. And also, I think that it can also affect people's mental health, because when you have questions about your body, about your desires, you don't have anybody to ask. You cannot ask anybody because you're scared that they will judge you or they will think you are immoral. So all of that can affect individuals' mental health. I think the solution to this would be that we should normalize conversations about sex, right? We should have conversations like this so often. And I also believe that we should create safe spaces for these conversations to happen. And I strongly believe that our religious leaders, community leaders, parents, even school and educational systems should also be involved in these conversations in their own capacity. And also, I also strongly believe that health providers, health educators should be trained to see sexual health as a public health topic, not as a moral one. Because when most people talk about sex or they are giving sex education, they come from a moral angle, and that does more harm than good. You know, there's enough research to even show that abstinence-only sex education does more harm than good. So yes, I believe that they should be trained to see sexual health as a public health topic, not as a moral one. I think that is the way forward, and that's the way to go. Thank
Right,
you.
thank you so much, Elizabeth Adewale. This is such an interesting topic, and you have broadened our perspectives. Thank you for giving us the education that a lot of us were not really aware that we needed. Thank you so much, Elizabeth.
Thank you for having me.
All
Thank you
right.
so much.
Truly, when it comes to sex, knowledge isn't just power. Knowledge is protection. And before we wrap up today, remember that if you have questions on today's topic or previous topics, then send an email to healthmattersbdtv.ng@gmail.com. I'll take it again, healthmattersbdtv.ng@gmail.com. I am Amanda Amos-Igbuwe saying stay enlightened, stay protected, stay safe, and keep watching Business Day Television.